All right, here we go. This is on the heels of my shorter little clip indicating that the final report had come out from the Senate subcommittee after a 2-year investigation into COVID-19 pandemic. So we're going to dig into a little bit more of kind of the themes and what came out of that report. So here we go. All right, the first thing I'm going to talk about is some of the key findings. So a lot of the findings can be grouped kind of into themes. Now it's over a 500-page report, but you can skim through it or look at things that just interest you. It's pretty searchable. Key findings, though, that generally there was little to no effective oversight, and this was in a number of different areas. Insurance, into the research actually being done and the likely cause of the pandemic, fraud prevention, all of the payouts and benefits and funding from the COVID relief efforts. There was just pretty much tip to tail. There was very limited or no oversight. We need actions to be science based. There was a lot of misinformation, a lot of myths, a lot of things just thrown out there as, yeah, let's do this with no actual evidence to support it. Lots of over reliance on levels above us. And we'll see that this was across the board, both countries relying too heavily on global institutions, states and provinces relying too heavily on the federal level, local relying on provincial or state, and individuals all the way up. So the whole thing is part of the picture. And preparedness was severely lacking. So just a couple of things to start off. The COVID-19 origin. The report indicates that COVID-19 was most likely emerged from a laboratory in Wuhan, China. The 5 strongest arguments in favor of the lab leak theory include: the virus possesses a biological characteristic that is not found in nature. Data shows that all COVID-19 cases stem from a single introduction into humans. And this runs contrary to previous pandemics, where there were multiple spillover events. Wuhan is home to China's foremost SARS research lab, which has a history of conducting gain-of-function research at inadequate biosafety levels. So we'll talk about what gain-of-function is in a couple slides. But again, the inadequate biosafety levels, that goes back to our theme of lack of oversight. Wuhan Institute of Virology researchers were sick with COVID-like virus in the fall of 2019, months before COVID-19 was discovered at the wet market, where it was claimed to have originated. By nearly all measures of science, if there was evidence of a natural origin, it would have already surfaced. Select subcommittee developed extensive findings, some of which include the U.S. National Institutes of Health funded gain-of-function research at the Wuhan Institute of Virology. The Chinese government, agencies within the U.S. government, and some members of the international scientific community sought to cover up facts concerning the origins of the pandemic. None of these are shocking to probably those listening to this right now. 3, Operation Warp Speed in the States there was a tremendous success and a model to build upon in the future. The vaccines, which are now probably better characterized as therapeutics, undoubtedly saved millions of lives. 4, rampant fraud, waste, and abuse. Abuse plagued the COVID-19 pandemic response. No shock there. 5, pandemic-era school closures will have enduring impacts on generations of America's children, and these closures were enabled by groups meant to serve those children. The Constitution cannot be suspended in times of crisis, and restrictions on freedoms sow distrust in the public sector. Should be among the public sector, but these are all findings, again, from this report. The prescription cannot be worse than the disease, such as strict and overly broad lockdowns that led to predictable anguish and avoidable consequences. Some of the high-level things. Okay, into the findings. The SARS-CoV-2, the virus that causes COVID-19, likely emerged because of a lab or research-related accident. EcoHealth Alliance, which was a company working in the Wuhan lab, facilitated gain-of-function research at the Wuhan Institute of Virology with poor or no oversight. So what's gain-of-function? Gain-of-function research is a term that encompasses a wide swath of life sciences, so research into that sector, and it's a subset of which involves creating potential pandemic pathogens. And according to the National Institute of Health website, gain-of-function meant a type of research that modifies a biological agent so that it confers a new or enhanced activity to that agent. So that's gain-of-function research. that the US was supporting and other agencies at the Wuhan lab. The US National Institutes of Health and National Institute of Allergy and Infectious Disease granted US taxpayer funds to the Chinese Liberation Army. Another finding from the report. Okay, poor or no oversight. So there was a number of things that the report talked about, but some of the big ones were the Paycheck Protection Program was rife with fraudulent claims, resulting in at least $64 billion of taxpayer dollars lost to fraudsters and criminals. Fraudulent unemployment insurance payments total more than $191 billion. Lackluster oversight resulted in transnational criminal organizations and fraudsters stealing U.S. taxpayer money from pandemic relief funds. Lots and lots of cases. It's not just in the U.S. Sure, this is a report from the U.S. subcommittee, but here in Canada as well, lots of things in the news lately and even before about how, there'd be clawbacks for all the incorrect payments of COVID relief monies to either companies or individuals, and lots of abuse, right from the government workers who were administering the programs down to individuals, both national and international crime. So poor or no oversight. And we've seen this in lots of cases, lots of things I talk about on this channel in risk management is about poor oversight. You have to have effective oversight and challenge of the things going on to actually have things work. Who runs the WHO? So the World Health Organization, in the report, a finding was that they failed to uphold its mission and that they caved into Chinese Communist Party pressure. The Chinese Communist Party violated Articles 6 and 7 of the International Health Regulations with no repercussions. And we've talked about that on this channel before too. If you have, especially if your control to prevent a risk is just a policy, you have to enforce it. There has to be repercussions. We're seeing that now with this is reminiscent of, or does it remind you of, other world organizations. So the UN, different groups like that. Oh, well, Russia or, a different group, Iran, whoever it is, pick whichever country you want. Oh, they just violated some UN regulations, but there's nothing done to enforce it. Oh, they crossed a red line. Well, it's not a red line if nothing happens now, is it? The World Health Organization's report regarding the origins of COVID-19 was incomplete, misleading, and parroted Chinese Communist Party propaganda. So, to go back to our question, who runs the WHO? In this case, come to your own conclusion. More harm than good. The report found that enduring COVID-19 lockdowns unnecessarily harmed the U.S. economy, the world economy as well. Again, you can extrapolate these findings from the states everywhere. Enduring COVID-19 lockdowns unnecessarily damaged Americans' mental health. Forcibly masking young children ages 2 and older caused more harm than good. Enduring the lockdowns disrupted the development of American children and young adults. And the lockdowns unnecessarily had severe consequences for Americans' physical health. So we're looking at mental health, physical health, educational development, all kinds of things. So the findings from the report indicate and point to that the lockdowns did more harm than good. Preparedness and over-reliance. We had an over-reliance at the highest level from the country levels all across the world to the World Health Organization. A lot of response plans, especially pandemic contingency specific plans, use the WHO levels and markers and what they push out as triggers for certain things that they will do. So certain response levels. Oh, if the WHO, the World Health Organization, goes to this level, we will then do this in our plan. If they escalate it to this level, we will do the next step. So the triggers are totally reliant on the WHO making correct, well-informed, and timely decisions. So we need to rely on ourselves first as countries. Again, this is back to the states specifically. The strategic national stockpile was not prepared. Things had not been maintained and had not been kept in a state of readiness. Individual states were not prepared. They were relying on the national strategic stockpile to be able to disperse things to all of the states in a timely manner. That didn't happen. Now, we could keep going down with that line of thinking. Individual cities, municipalities, areas within each state were relying on the state, and individuals were relying on the local government. So you can see where this goes. It has to start, and we've been preaching that from day one on this channel. It starts with you. It starts with the individual and the family, and then it goes up. A lot of other things can come top down. Preparedness starts at the base level, at the foundation level of the individual and the family. You need to be prepared. Then you can start, once you can start working on getting your community prepared, and it spills upwards, it snowballs upwards. You can't wait for the trickle down from government. It's not going to happen. Or governments relying on world organizations like the UN or the WHO. Unsecure supply chain risks continue. Well, we saw that. That was the big one, right? Everything, every supply chain, from toilet paper to medication to ammunition, food, materials, everything was disrupted because we've relied too far and gone, too much one way on just-in-time delivery, all sorts of, super efficient. That's great for the bottom line, but really, really bad for business continuity. The United States must reduce its reliance on other countries, particularly China, for pharmaceuticals and medical supplies. Well, again, this is every country. We need to get back to areas of producing things within our own borders. Sure, it might not be the most efficient, but it does help the local and national economies, and it does make us less reliant. Now, yes, you have to, within reason, have that, but for example, the masks. There was tons and tons of examples of most of the masks are produced in China. And if they just basically turn off the taps to that, we're done. We're looking at that with critical materials and minerals and things like that now. We have to get back to having our own ability to produce these critical things. Science-based, not misinformation. So quantitative scientific support for many actions was lacking. One thing they found, rapidly implementing travel restrictions can save lives. So that was looked at, and they found that was a really useful thing that could happen. Governments perpetrated COVID-19 misinformation. Public health officials, they're flip-flopping on the efficacy, so things doing what it's supposed to do, and the use of face masks without full scientific transparency caused mistrust in public health establishments. That can be shaky to begin with. And if you don't do things scientifically and on fact-based information, and especially if you go back and forth with your recommendations or the rationale for it, that's not good. No quantitative scientific support for 6 feet of social distancing. The Biden administration, this is all from the report, exceeded its authority by mandating masks. And we saw that in other places too, these different public health mandates. Different courts now are finding that the governments, wherever they were from, exceeded what they could actually do. They went beyond where their scope was. The U.S. Centers for Disease and Control and Prevention relied on flawed studies to support the issuance of mask mandates. So lots of things, again, but the root of it, the theme is it has to be science-based. It can't just be, well, I think this might work. And here's the full, if you want to read the full report or go through it, I just have it here. It's the oversight.house.gov, to release the final report. Type that in or look for a final report. I'm sure it's starting to get a lot of traction, but that is where you can find more information. It's an interesting read. Go through it. You might not agree with everything that's in it, but to make good risk-based decisions, we have to be able to hold some opposing thoughts in our head, and we have to look at all the information from groups we agree with and groups we disagree with. So have a look, have a read, come to your own decisions. But again, go back to the themes, and the big one for me is that preparedness. Focus on your individual and family status first for whatever that is, medical, financial, security, all of those things. We have to look after ourselves first. Thanks for listening. Like and subscribe.